Welcome to the early risers in Toronto, rainy Toronto, as I understand. Good Friday afternoon to our friends from India. Welcome to everybody else across all the places in the world that have joined us today for an exciting and most informative webinar with, I might say, exceptionally impressive and accomplished set of panelists. I'm a professor of strategic management and international business at the Schulich School of Business, and I'm a director of our program in India. But today, and for the last 2 months, as you can see from the background, I've been talking to you from Athens, which is halfway between Toronto and Hyderabad. Part of why we're talking about today, which is the pandemic and the lockdowns and where it has found each one of us. But don't feel sorry for me. I have the better weather from India's monsoon season starting up, or Toronto that refuses to get into the spring still. Our webinar today is part of Schulich series of Shaping the Post-Pandemic World and represents one of the school's many initiatives in response to the current crisis. Over the last 6 weeks, the series, which originally was conceived by my good friend and colleague, Professor Ashwin Joshi, has brought together the thought leaders and experts from our Schulich family to the broad Schulich community, and has asked them to share their insights, their perspectives, and of course, make suggestions to all of us about how we can shape the post-pandemic world to make it a better, more inclusive, more engaged, and a more a positive place for all of us. Ashwin's original idea, our good friend Rantu Basu, one of the founding partners of Quest Partners in Mumbai, and our long associates in India, spearheaded a number of webinars that explicitly focus on India. As many know, in our prior webinars, we addressed financial, technology, leadership, agri, and food sector issues. And today, in collaboration with our friends at Indo-Canadian Business Chamber and their CEO, Nadir, as well as Canada-India Business Council and its CEO, Victor Thomas, we have tapped on our own India Advisory Board to bring 3 exceptional panelists with illustrious careers to share their insights on the healthcare sector and to challenge us to think of ways the sector is responding to the crisis, can respond to the crisis, and important for us, how our 2 countries can benefit from closer collaboration in the healthcare sector. So, as with previous seminars, we have structured the session to give each of our panelists a few minutes to share some of the initial insights and essentially get the conversation going. And then we will go to your questions. So do get typing in your questions, and hopefully we will have a chance to bring them up and get the conversation going. Our first panelist, who is probably known to a number of you as Joseph Mapa, a professor and the executive director of the Health Industry Management Program at Schulich. However, Joseph's career for the most is in the health sector. He was the president and the CEO of Mount Sinai Hospital. And then when the hospital became part of the Sinai health system, he became the founding president and the CEO of a larger group of centers, institutes of research, centers of rehabilitation, medicine, and all sorts of other elements of the health sector that we're so proud of in Ontario. Joseph was also, very importantly for our discussion today, chair of the Council of Academic Hospitals of Ontario for a number of years, as well as on the governing council of the University of Toronto, the other university in our city, and brings these kinds of knowledge and experience to the conversation today. Joseph, we're all.
Thank you very much. And Thank you for the opportunity to share my perspectives on the Canadian experience with COVID-19. My overarching thesis today is that Canada's healthcare system is outperforming most, if not all, jurisdictions in North America. And it's principally because, especially in compared to the United States, because of our cultural and social norms, and I will explain. Let me start with 2 proof points. First, next to Japan and Germany, Canada has the best coronavirus record for any large Northern Hemisphere country. Second, hospitals are safe. Public compliance is relatively high. By comparison, Ontario province, which I live in, is outperforming most, if not all, jurisdictions in North America. Ontario, you can think of it as a microcosm by extension for the rest of Canada. There are exceptions, of course, and some troublesome issues. But generally speaking, the Canadian experience is relatively positive, if I can use that term in this context, in the most immense public health and economic crisis of our century. Our federal government deserves important credit for that, with its disciplined border policies, financial aid plans, and how it's tapping the private sector to help battle COVID. But the provincial and territorial governments have been instrumental and key to this effort in all aspects. Our healthcare system reflects this perfectly. Canada, as you may know, is well known for its publicly funded, tax-based universal healthcare system. But the fact is that our healthcare system is less a true national system than a collection of decentralized 13 provincial and territorial insurance plans covering essential hospital and doctor services, which are free at the point of care. We do not have private hospitals. Our public system is the dominant provider of healthcare services in Canada. While our performance can be attributed to our governments, healthcare providers, the public, the private sector, which I will speak about in a moment, it's worth digging a little deeper and ask, what are the drivers, what are the dynamics that differentiate Canada during this crisis, especially in comparison to our neighbors to the south? By the way, it's also my belief that all things being equal, and that is if we experience the kind of surges, diversity, the kinds of pressures, demographic pressures and density pressures that others are experiencing in some of the other hotspots, we will still be more effective, whether it be in the surge management phase of this disease, the disease management phase, or for the long term, the vaccine rollout and future-proofing phases of this crisis. And there are reasons for this. In the interest of time, let me sum it up this way, and there's relevant empirical evidence to support this. Canadians are more traditional, more collectively and community-oriented, less individualistic, more risk-averse, and exercise greater caution and restraint, especially in compared to the States with this intrinsic focus on the rights of the individual. And you're reading about this every single day. So our behavior during this crisis is rooted in our cultural and social values, as is the design of our healthcare system, which works for and addresses everyone in our society. This is particularly suited and significant in a population community-based oriented disease such as COVID-19. But there are other important drivers in play that I can elaborate on during the Q&A. And these include the trust Canadians place in their government, the lessons we learned from the SARS experience, the last Black Swan pandemic event, which Toronto, Ontario, and Mount Sinai Hospital, which I happened to be at the helm at that time, was the epicenter. And lastly, and of particular significance to the way in which governments, and lastly, particular significance is the way in which governments, hospitals, and in particular the private sectors are working together with a unified sense of purpose. It's a whole of country attitude, and the role of the private sector is indisputable. And there are reasons for that. First, the economic downturn and declining tax revenues. The public sector is insufficient to tackle this crisis alone, can't do it alone. Second, private sector organizations have the expertise, the drive, the entrepreneurship, the capability, and the resources. And third, in pure pragmatic terms, our healthcare system's main supplier is the private sector. I won't provide you with a roundup of the activities and initiatives undertaken by the private sector, but they are comprehensive and pertain to diagnostic tests, ventilators and respirators, medical supplies, logistics support, social media, and yes, even charitable giving that you've heard about. Companies are repurposing their factories and are leveraging their comparative advantage in every single sector. Impressive activity, which shows that it's possible, if not easy, to produce emergency alternatives closer to home when global supply chains are disrupted. And how are hospitals performing? The fact is that in the main, throughout North America, hospitals are competent, safe, and effective. Canadian hospitals, I believe, benefit in particular from the cultural norms and experience that I just described. Again, in the interest of time, let me just summarize and say, it is my experience that hospitals and caregivers in particular are superb in crisis management, and COVID-19 is certainly no exception. Our hospitals have been effective with their focus on capacity management and surge sensitivity, protocols and processes, equipment and supplies as available, and especially its proper consumption, talent management, including staff deployment and addressing mental health needs, and of course, communication, which has to be often and has to be clear. But there are troubling spots that we have to address. First, our long-term care and retirement homes are bearing the brunt of the pandemic tragically. And I can speak to this later on, but the reasons are rooted in accountability and lack of protocols and disciplinary regimens. Another troubling consequence has been the postponement of elective procedures and surgery. There are more rational reasons for this, but again, this has to be addressed. Indefinite delays can lead to people having bad things happen while they're waiting. Bottom line, one, a predicted surge in COVID patients has yet to materialize, suggesting that the province-wide social distancing and other stay-at-home measures, systematic and disciplines are paying off. We flattened the curve. Two, hospitals have the capacities to care for COVID patients with current availability of beds and resources, suggesting that the combination of strategies deployed by our hospitals are working with governments are effective. The fact is that the pandemic has not crushed our hospitals in the way it has in other jurisdictions, such as New York, for example. On a broader scale, and this is more rooted to the theme this morning, COVID-19 should be sobering to policymakers and health system leaders throughout the world. There are many issues, some examples. One is the relationship of public health and economic health. How do we secure a safety net for both imperatives? Two, emergency preparedness in all its aspects, including self-reliance versus dependability, ensuring your supply chain for essential items are local. Three, design capacity strategies that accommodate normal and day-to-day activity electives, for example, during a crisis. These are also an ethical question. Should a pandemic crowd out other imminent and very important healthcare issues? Four, hospital physical design needs to be optimized, accommodate increasing challenges and pressures such as pandemics and also mass casualty events. Five, in particularly in the context of today's webinar, it is vitally important that we learn from the current experience and continue to foster best practices for public-private cooperation, including the changes needed to be better prepared for the next crisis. And lastly, and I'll stop after this, governments will have to consider long-term improvements to public operations, becoming more digital, revisiting supply chains, and monitoring for future pandemics more effectively.
Thank you very much, Joseph. A great introduction to our topic and a great way to get us up to speed to what Canada has been doing. Now we will shift gears. We will go to hear from one of the great friends of the school, a member of our advisory board in India, and one of the women that have created, by many accounts, the modern private healthcare sector in India. And this is none other than Ms. Preetha Reddy. Preetha Reddy is the Executive Vice President, Chairperson of the Apollo Hospitals Group, which everybody who knows about India knows that it is the foremost integrated healthcare provider in India and in Southeast Asia. She has been widely recognized for her contributions to make the high quality healthcare of the Apollo Group accessible to millions across India. By some accounts, the Apollo Hospital Group has touched over 150 million people. She is also the managing trustee of the Apollo Hospitals Education Trust, and that's where she finds time to also help the Schulich School of Business to make its mark and be a valuable contributor in India. Very quickly, let me say two things about the Apollo Hospital. 9,000 clinicians, 150 million people have been taken care of in its facilities. These people come from 140 different countries. For those of us in India, we know how important health tourism has been in India and has helped the sector in India. Very importantly, Preetha has also found time to work with the government to advise ministers and prime ministers in making policy decisions and help move the healthcare sector in India to what all of us aspire to. So it is a great privilege, and we appreciate very much hearing from you and the comments you have to share with us this evening, Preetha.
Thank you, Professor Theo. It's, as always, an honor to be with senior faculty, and thank you for the invitation, Mr. Patel. Nice seeing you again, and Professor Mapa. I'm so impressed with the kind of perspective you've given, Mr. Basu. Good meeting you, and of course the faculty, alumni, students of the business school, members of India-Canada Business Chambers, guests on this webinar. It is a privilege to address all of you and really share some of the best practices in our country, look at what Canada has been doing, and I look at it with total admiration. We are all literally in a time warp. Many of us woke up one day and realized that all our business plans, all our strategic plans have really been thrown literally out of the wind. And today we have to have a singular goal of how are we going to shape the post-pandemic world, because each one of us really has a role to play. And sometimes I wonder what the right normal is going to be, because there's a greater focus on a sense of balance, and the triple bottom line again would gain much more momentum because the world would be more equitable and definitely, as we've seen, inclusive. So I think the borders have become narrower. We've gotten closer thanks to technology, and definitely cultures and philosophies merging. So to get started on India, what is India? It's a huge country, diverse cultures. And what is the healthcare in India? It's evolving. It's evolving as a strategy. It's evolving as a commitment. And my country today is the world's largest democracy, 1.38 billion Indians. Over 65% of them are under the age of 35. So we're the youngest, one of the youngest populations in the world. But 70% of India still lives in her villages. And therefore, the efforts for development have to be far-reaching, they have to be huge, and the economics of growth have to look at the geographic divide, the economic divide, and try and see how we can think and be so far-reaching that we take whatever we do in the cities to the rural villages, because 70% is again in the rural India. The government of India spends 1.3% of our GDP on healthcare. And in a way, I'm jealous. I'm contrasting it with Canada, and you spend 12% of your GDP on healthcare. So you can see where the huge gap already exists. Again, the health sector in India is one of the largest in the world, both in terms of revenue and in employment, because it employs close to 500,000 people. And in terms of revenue, it's about 8.6 trillion rupees, which is about 1.33 billion US. And that's what it's going to be in the next year if all our plans had gone the way it should. But having said that, we were always acutely short of nurses and doctors. But then our nurses and doctors man some of the best centers globally. In the developed world, there is no healthcare system without fantastic Indian doctors or superb Indian nurses, or in science or development or pharma research. Our Indian people of Indian origin occupy some of the best positions. So I think, you know, if we can find a way to really merge the borders, merge the gaps, and see what happens in one country, in one healthcare system can quickly be adopted in another, I think it will be pretty amazing. We need to also understand that still most Indians pay out of pocket for healthcare, and that is probably one of the reasons that we see so much of poverty. But in 2018, the Prime Minister launched one of the most amazing plans to reach of universal healthcare, which was called Ayushman Bharat, PMJ. And that was today reaches almost 40% of India in some way or the other. And it provides 500 million Indians with a cover of 500,000 Indian rupees per year for their medical treatment. So I think where, you know, old adage, where there is a will, there is a way. And we are now showing that healthcare can actually be accessible. On the 21st of May, there was a small celebration because of the pandemic, but 10 million beneficiaries received medical treatment. And if we did not have this plan and we have the COVID crisis, there would have been a large number of Indians who would not have been really able to pay for healthcare, despite the government's efforts, despite the private sector and the trust-run hospitals. And I think that's why the program is a paradigm shift in our, you know, old ways of thinking and the way forward. It was also very heartening for us to see that our present Indian Union Health Minister took charge of the WHO Executive Board as a chairman. That again to us is probably an acknowledgement of the fact that India is really doing a lot in the healthcare space. What are we doing on combating COVID-19? Sometimes it seems like, you know, whatever we do is just not enough. People thought that the lockdown will actually give us a lot of time at home and a lot of time to really relax and enjoy the time, the personal time. But I think healthcare providers have been working literally 24/7 on doing a lot of work to see that, you know, the crisis doesn't get out of hand. I can't say it hasn't gotten out of hand, but I can say honestly that we're trying. Early on, India embraced an approach of prevention and containment. And there are about 1.6 lakh, which is about over 161,000 patients in India. And 70 of those cases are in the urban areas. And cities like Mumbai have a large number. And, you know, this is about 11 cities in India. Today, we're on day 70, actually, of the lockdown. And let me tell you that if this step of this huge, I mean, the world's largest lockdown had not been taken, we would have had over 1 million cases by now. And that to me would have then been a crisis which gets completely out of hand and nobody would have been able to do anything. I come from an organization of, you know, a healthcare organization which does hospitals, pharmacies, education, training. And amidst this crisis, I think, you know, the whole team stepped up and we launched, because our chairman christened it as Project Kavach. Kavach in Sanskrit means an armored, means a shield, which gives protection. And it was designed as a comprehensive countrywide response plan. So there was an AI-powered COVID risk scan, which was the first one. And it helped over 13 million individuals check if they had symptoms and guided them for a suitable response. There was self-quarantine, which was introduced and educated. There was a project Stay I, where we, worked with with hotels and provided 5,000 rooms for early quarantine. Our education institutions created a lot of e-learning programs to train people on ventilator management, to train nurses on how to manage the COVID, to provide actual treatment. So, and then there was Apollo 24/7, which was a call center, which again received about 5,000 calls a day to let people know what they had to do. But it's all about rebuilding and reimagining. And I'm wondering that, if a country like India could rise up to the pandemic, what were the few things which were done to make us, innovators? Most of our medical, either equipment to consumables, were imported. We were importing a lot of whatever we use on a day-to-day basis. But then today we produce PPEs, N95 masks, ventilators, all in a span of 2 months. That institution turned around and said, let's truly see if we can make in India. And I think that showed Indians that, they could do so much more during this crisis. We have about 8 institutions who are very close to really providing a vaccine. And all of us are praying, we're very spiritually inclined. And we're praying very hard that, one of the answers for this crisis, a vaccine, would truly be available in India, would be made in India, and would be, affordable in India. Because for us, affordability again is a huge, huge problem. And we're hoping that, there would be answers for things like that. We are working closely with, there was always a divide between the public sector and the private sector on providing healthcare. But I think this crisis taught us about partnerships, about the new normal, about innovation. And so there have been multiple organizations who have stepped up. They have used AI, they have built clinical pathways so that the healthcare providers can really address the disease. And if you really look deep into the outcomes on this crisis, you will see that some states have performed very well, that the death rate is much, much lower in some states as against the other. So I think the answers have come up because we had no other way to do it. We had to dive off the deep end, but the frontline workers, the healthcare providers have done incredible work. One of the issues which really hurt us badly was the way the migrant labor crisis happened. And that was something which was not anticipated. Most of our economic development is in the cities. But suddenly we found that the migrant labor, which came from, all the deep pockets, the rural areas, felt like that they needed to go home. And this created another pandemic of its own. But people came up, whether it was the private sector, individuals, or the government, came up with so many solutions to take care of them, especially giving them food. That was a big problem. And we knew that, India is a land where people think people go hungry. But the citizens stepped up, and on a daily basis, some organizations have provided 200,000 to 300,000 meals for these migrant laborers. So I think, there are answers both from the mind and from the heart. And while we come up with long-term solutions, think deep, make strategies, make plans, which will be which will work for tomorrow's world, I think in today's crisis, as humanity, people have stepped up to give us some amazing results and outcomes. The future looks like we need innovative solutions, progressive fiscal measures, and groundbreaking partnerships. Gone are the days where we think we can function in isolation. It doesn't happen. And particularly for the younger audience, you will shape our tomorrow. A silver lining amidst the darkness of the coronavirus was cleaner air. And I hope it stays. I hope we can really ensure ourselves with cleaner air. The chirping of birds, which some of us had forgotten what it sounded like. And even the Himalayas was visible from hundreds of kilometers. Never happened in so many years. So the lesson is that we must transition from conscious capitalism, wherein the business strategy must be to benefit, but today it should benefit both the human beings and the environment. Because unless the environment and human beings work in tandem, work together, and not in two separate silos, the future will hold many more pandemics and crises. And in conclusion, it is said that the future actually belongs to those who can envision and create it. So it's in all our minds, and it's in all our hands, and it's in all our hearts to build a healthier and a happier world. Because a happier and healthier world is for the generations we're going to leave behind. I have a grandson who's going to be 4, and I truly want a healthier and a happier world for him. And I'm sure all of you would want that for the generations to come. But the answer, my friend, is not lying in the wind. The answer is lying in our hands. And we need to get out there and do what we have to do so that the world is a safer world. So stay healthy, stay safe, and most of all, stay peaceful and happy. Thank you and namaste.
Namaste. What a positive, uplifting message, and great comments. Thank you, Preetha, for bringing that beautiful perspective and giving all of us hope that India can do it, the rest of the world can do it. But before I get too excited about these comments, let me introduce another great friend of the school. Let me introduce His Excellency, the High Commissioner of Canada to India, who also happens to be the Ambassador of Canada to the Kingdom of Nepal, and he happens to be the Ambassador of Canada to the Kingdom of Bhutan. And most importantly for us, happens to be not just a member of the school's advisory board in India, but also a great friend of the school, Nadir Patel. Nadir Patel is, as I said, the High Commissioner of Canada to India. And before that, he was the Assistant Deputy Minister and Chief Finance Officer of Canada's Department of Foreign Affairs. And for those of us Canadians, what does that mean? About $10 billion of budget and about 10,000 employees. Nadir has been in the public sector for a number of years, but he has made his mark in so many ways that a number of organizations have recognized him as, for example, one of 100 Canadians most influential in Canadian foreign policy, or one of 45 Canadians aimed to change the world. Nadir has been in India for now close to 6 years and has single-handedly changed the relationship between the two countries. But I should get out of the way and ask Nadir to share with us his perspective on how we can bring in the healthcare sector the two countries close together.
Thank you very much. Thank you, Theo, and thank you, my colleagues, Preetha and Joseph, for those wonderful comments to set the stage. I'll try to be brief to ensure that we have as much time for questions as possible. And let me just share with you the perspective from which I would approach my remarks really is to take those very insightful comments from the Canadian perspective and from the Indian perspective and attempt to bridge them together by demonstrating a little bit of where we are at in terms of the Canadian High Commission and our programs and activities here in India in support of addressing some of the challenges, but also capitalizing on the opportunities in the healthcare system, particularly through and post the pandemic crisis. So let me just take a very short step back and say, look, over the last 5 years or so, the Canada-India commercial relationship has been thriving, record numbers across the board, every single metric in 2017, 2018, 2019. For the first time, two-way trade in merchandise broke $10 billion last year. Add to that services and every other metric, the number of Canadian companies active here, investment flows both ways, people-to-people ties, immigration, educational ties, everything continues to thrive on a very robust and record-setting basis. And there are reasons why that's happening, but one of those reasons is there has been a deliberate shift over the past couple of years to start looking at sectors where we haven't done a whole lot, but we see potential. And one of those sectors, among others, and is certainly the healthcare sector, the healthcare ecosystem as a whole. We heard a little bit from Joseph what's happening in Canada right now, and I think you could extrapolate some of those comments to reflect the broader ecosystem that Canada has to offer. And we heard from Preetha what's happening in India right now and the success over the last few years and the challenges and where things are going. Well, I think there's a natural synergy here between what Canada and India can do in an area that has potential to grow, where Canada has had some success over the past several years. So right now, you know, if I just go back a few months ago, pre-pandemic, I would have identified healthcare as one of those areas where we were looking to do more. And there are many Canadian companies that are active here in India in this space pre-pandemic. Today, I would argue that there has never been a time where the imperative to really explore those synergies, or where we could collaborate, where we could support each other in terms of addressing some of the challenges and capitalizing on some of the opportunities. Today, that this environment with the pandemic and the crisis that we're under underscores that there's never been a more important time to really focus on healthcare as one of our priority areas of focus. We here at the High Commission and our trade commissioners are right now going through a bit of an exercise in terms of what is the way forward once we make it through the crisis stage, look at recovery. Certainly, we'll want to ensure that the investments that have been made by Canadian and Indian companies in this space for the benefit of bilateral commercial ties are able to continue, are able to thrive, come through the pandemic as successful as possible, and then leverage that success for renewed opportunities going forward. So we're doing a lot of thinking right now. So these opportunities to hear from folks like Preetha or Joseph provide a great opportunity for us to inform some of our thinking as we strategize going forward. And we'll look forward to walking away with some ideas, including through the Q&A in this session as well. So as we navigate the next several months in particular, which is what we are navigating through the crisis stage, and start thinking about the recovery stage, whenever that is, you know, going to trigger, if you will. We see a lot of potential in this sector going forward, building on what's already happening. And I'll just touch on very briefly 5 areas that we see in particular having significant potential in the context of synergies between Canada and India. And I will say that the pandemic has raised a lot of questions around the world on the part of any countries in Canada, in India. There's certainly a desire to look at ways to shock-proof, learn some lessons that have been through experiences through this. And there's certainly also a tendency to focus on what we need to go it alone, or to ensure that some of the challenges that countries have faced are not faced going forward. But in so doing, we remain very adamant that there's still more that we can do together as partners than we could if we went alone. And some of those, some of the examples to support that in these 5 areas, I'll just touch on. One, and I won't get into these in a lot of detail, but I'll just give you a little bit of an intro. One of them, of course, is the pharmaceutical sector. India has already been leading around the world, being a very significant producer globally of pharmaceuticals, vaccines, active pharmaceutical ingredients. And I think its leadership in this space can be quite valuable in navigating the pandemic, but also coming out of it as well. But at the same time, Canada and India together can further leverage this by looking at some of the expertise in the Canadian healthcare sector, making use of Canada's extensive commercially oriented research network. Indian pharma companies can more easily take advantage of some of the innovations from laboratories and commercialize those innovations. And there's already Indian companies invested in Canada, Canadian companies invested here, and we're seeing some of that grow as we speak, including through navigating the current COVID-19 crisis as well. The second area is broader research and development collaboration. We have a science and technology agreement with India. We have a number of initiatives in that space. Over the last decade, the trend in the global pharma industry in particular has been to externalize some of the drug R&D programs and manufacturing through partnerships with academia, SMEs, government research centers, and we're doing some of that through our S&T arrangements here with a particular focus on Canadian innovators recognized internationally and bringing some of the R&D excellence here in India. And Canada has one of the highest numbers of biotech companies in the world. We rank 9th globally in terms of capturing the world's clinical trials. We're ideally suited to build on some of that R&D work here a bit more aggressively as we go forward. And I think this crisis has brought forward that to the forefront, perhaps more than other opportunities in the past would have dictated or showcased. The third area is in the medical devices and diagnostics space. There are a number of existing collaborations that are proving to be quite fruitful between Canada and India in this area. Canada's medical devices market itself is expected to reach over $10 billion in this year alone. We've got a very well-developed medical device ecosystem, about 1,500 Canadian companies concentrated in Toronto, Montreal, and Vancouver. 95% of those, of course, are SMEs. And their strength very much is in innovation and adapting healthcare technology to various needs, including the current crisis as well. And here in India, there certainly is a push to develop a more robust medical device and diagnostics ecosystem. And we see some opportunities for closer and greater collaboration in that space as well. And I think a lot of that's driven by innovation. And we see innovation as an area that is very broad-based, but in the healthcare sector, much more can happen and is happening individually in both countries, but perhaps bringing it together could yield a more amplified results. The next area is digital healthcare. And several processes in the life sciences sector, such as advanced manufacturing, alternative drug delivery mechanisms, and pathological tests are now driven by artificial intelligence and the Internet of Things. And these technologies require big data. And this is another area of obvious collaboration. And in this particular space, we see a number of things happening, but perhaps the current crisis is raising the profile of some of these opportunities more so than in the past. Canada is a world leader in AI and the Internet of Things and has a significant technological advantage. Now, at the same time, however, our population is small. Data gathered here in India's large population can be used with respect to revealing new technologies through the implementation of AI initiatives as well. And there are some discussions and initiatives taking place and have been in the past. But I think the emphasis on growing this ecosystem is going to put more opportunity in addressing some of the challenges going forward. And I think this is something that we will certainly want to amplify our efforts as trade commissioners quite a bit more going forward as well. And then finally, I'll just touch on infrastructure, healthcare infrastructure. Canada has significant experience in both physical infrastructure and educational infrastructure in the healthcare sector. And we've developed a lot of expertise over the years, designing hospitals, diagnostic centers with adaptable designs so that can be tailored to different situations. And we have over 30 years of experience in delivering successful public-private partnership projects in social infrastructure. And we have had some discussions in this space, given India's desire and aim to develop so many new healthcare centers and hospitals, particularly in different parts of India, in rural areas of India as well. And this is an area, of course, that both Joseph and Preetha, through their respective experiences, have had a lot of expertise in as well. And we see this as an area that could further contribute to addressing some of the ongoing challenges here and also capitalizing some of the opportunities as well. So I think it's just to conclude, these are just a few examples. where we are at right now is, as I said earlier, strategically starting to think a little bit about what are some of those opportunities going forward in a way that could help address challenges. And if we think about this mindset of doing more together in order to benefit and leverage opportunities for not only economic growth and recovery, but also for social impact, i.e. through developing a more robust healthcare ecosystem accessible to as many people as needed. I think this is an area that we will make a significant priority in terms of sectors of focus going forward. So bringing it all together, hearing from Joseph and from Preetha, I think these experiences can be quite valuable in our efforts complementing how we can leverage this sector for the benefit of both countries going forward. I'll leave it at that for the moment and turn it back over to you, Theo. Thank you very much once again for the opportunity to share a few thoughts.
Thank you, Nadir. Thank you. Excellent and quite comprehensive and very much forward-looking, which is exactly what we expected to hear from you. Very much appreciated. Let's get right away to questions. And I have a question from Nadir to Joseph, and of course is asking him to comment on the areas of the Canadian healthcare system that showed cracks, where things didn't work. But more importantly, does he see the system revamping itself in the short term in response to those, to what the crisis has brought up about the weaknesses of the Canadian healthcare system?
The answer, in short, to the question is, I think that the pandemic has created an atmosphere which is going to accelerate disruptive interventions in all aspects, whether it's the kinds of partnerships or the kinds of best practices, or even in the areas of global preparedness. You know, this pandemic has ignited first of all, a certain amount of courage, second of all, a certain amount of innovation, and third of all, a certain amount of embracement of what can happen in the future and the necessity for it to happen. So in healthcare in particular, I think this will have a major, major impact. I sort of painted a very, very positive picture of the Canadian healthcare system, which is certainly remains so. But like all systems, it has its challenges, whether it's fragmentation, cost containment, aging, and so forth. And what this particular pandemic has also highlighted, of course, is the problems we have with long-term care facilities and so forth. So I think that the answer in short is that this system, I think, is going to have some very, very purposeful changes as we go forward. And people are now prepared for that.
Thank you, Joseph. Let me shift to Preetha. Preetha, you made the point in your very positive comments about India and how India was able to pull itself from the boots and start producing a number of things. And of course, a question that came from Johnson Matthew was whether, in what percentage, if you know, that India has been able to reduce its reliance on China. And do you see this as a long-term opportunity for India to become more self-reliant and, of course, in the future, also an exporter of health-related products and services?
I think it's definitely a possibility for India, because in such difficult times, nobody wants to say it's an opportunity. But we're just seeing that within 3 months, the production of, they're producing about 500,000 PPEs and N95 masks per day in India, a country which never produced it. So I think they've done that. They produced high quality ventilators, which are really, usable. So if these things can be done so quickly, I think we can definitely become a hub for medical manufacture, for devices, for consumables. Maybe the high-end ones, already there are suppliers and the volumes may not be enough, but if we can innovate, and I remember GE did it with the ultrasounds. There was a time when the ultrasound machines were just so expensive. the Innovation Center in India brought out an ultrasound machine which was less than 1/10 of the cost. And now even in the small areas, small, little medical centers have access to ultrasound machines. So if you extrapolate that and say that can we do it for, so many other areas, I think India can definitely manufacture. The global pharma supplies, I think we are the largest supplier. So we've done that consistently over the years. So we will be able to do it. But the piece which I think is going to be an answer for a lot of the countries, especially the developed nations, is that they have to deal with a huge aging population, which we heard earlier. And we have technically the largest English-speaking workforce. So I think skilling in India, managing a workforce which can then be deployed anywhere in the world to take care of their healthcare needs, take care of the aging population, would be a great collaborative effort, a great opportunity for people to, find jobs. And I think that would probably be the greatest service possible. And that's why we like working with institutions like yours, university like yours, because then the learning and the teaching modules can really be imparted to the Indian audience, and then they can come and work anywhere. To me, that seems like, one of the greatest contributions and one of the best collaborations we can come up with, skilling healthcare workforce.
It's a great comment, because that's exactly where Nadir was suggesting that there are opportunities for the two countries to work together. But Nadir, there was a question, since you brought it up, that talked about the role of artificial intelligence in the healthcare sector. And Parth said, what do you see the role of AI in the opening of the economies till the vaccine or till treatment comes along? And where do you see the role of AI in the healthcare sector in India and Canada in that respect?
No, thank you for that. Let me just start off by saying that, the AI expertise in Canada has been in India in the context of various collaborations for quite some time now in various sectors. So we've got a very solid head start in terms of Canadian companies, Canadian universities as well, and various initiatives leveraging some of Canada's expertise for the benefit of companies, research, and practical applications here in India in a range of different sectors. And we've had active discussions with the government of India as well in how we can in fact further contribute to advancing Indian interests in its ecosystem around using artificial intelligence for practical purposes as well. And in the healthcare sector, there are a number of initiatives as well. I'll just give you one example. There's without naming companies, there's an Alberta-based company from Canada that's been providing predictive maintenance analysis using software tools based on AI and the Internet of Things to some pharmaceutical producers in India. And these tools have helped these industries or these companies be more globally competitive by allowing for improved efficiencies or efficiency gains, reduction in operating costs, and significant improvements in future planning abilities as well. That's just a very small example, but you can take that, you can think a little bit about how you could extrapolate that across the various subsectors within the healthcare ecosystem that I talked about. And I think another thing that's worth mentioning is, the success of AI-related initiatives often is in data and or a contingent requirement, if you will, is data. And Indian data gathered from 1.38 billion citizens can be quite valuable in the context of points that could be used to help develop pharmaceuticals, look at research, even vaccine development, or other initiatives in the Indian healthcare ecosystem. So you can see that if we can bring some of that technology and apply it using data sets here, it could be quite valuable. And that's sort of the spirit of that thinking that's going on, or some of those practical initiatives.
Can I just add to that for a minute?
Can I just add here? You know, we as a group have developed AI to better predict cardiovascular disease, because earlier the data was all based on Caucasians, and we know that, you know, the Asian genetic makeup is a bit different. And so this has become very valuable, and it's, you know, almost working hand in hand with the Framingham risk score for cardiovascular disease. And we see the same thing happening with diabetes, the risk of getting cancer, because, you know, certain cancers are very intrinsic to the Asian population. So I think using AI to predict the onset of disease with the genetic makeup will be very valuable information for research going forward.
So if I can just build on that, I think AI is a very important part of the future, and we know it's the applications are universal in every area: personal genomic medicine, diagnosis, all kinds of things. But one of the things that this pandemic has brought out is the issue of supply chain management. This cannot be underestimated. It has to be hereon taken as a very major issue is going to the future. And AI can play a major role, particularly in the area of predictive analytics, in the whole area of supply chain management, including the application of digital supply chain management. So I want to emphasize that as well. So AI does have a role for the future, and the commonalities you speak to, of course, are welcome globally.
Great. Thank you. Preetha, there was a question from Vijay about the dramatic recovery rates that India has been reporting. Are there specific practices that you think can be attributed to that success?
You know, I'd love to say that, but we don't have data to prove that yet. But what they are saying is that the Indian genetic makeup, and because we've been exposed to, you know, so much of bacteria and viruses and God knows, that the Indians are able to fight it much better and much faster. So that may be one reason why. And the population, again, as I said earlier, is a much younger population. Some countries have a larger aging population who, you know, have to deal with it. So maybe, you know, the younger population mix is another reason. The third reason, which is very valuable, is the culture of the Indians. You know, we always, the elders have help at home, or they have, you know, they're living with their children. So I think their healthcare needs are watched much better, and problems are picked up so much earlier because they're not really living alone. And then they get interventions are much quicker and much faster. So these were the three reasons why they feel that the average death ratio for COVID has been, you know, fairly low. And I'm hoping it will stay that way and something doesn't happen to make it dramatically worse.
Okay. We all hope so. Absolutely.
Yeah.
Nadir, following up on you identifying a series of a number of areas where collaboration could be very productive between the two countries, Faisal Beg is asking whether there are specific initiatives underway by the government to bring Indian and Canadian decision makers together, bring specific bodies together to push this initiative, to push these directions forward in concrete ways.
So, no, that's a good question. Let me set it up by sharing this, that our trade minister and India's commerce minister have spoken 3 or 4 times over the last 6 weeks or so on a range of issues, particularly on collaborating on COVID-19 related issues. Our prime ministers spoke, I think about a week and a half, 2 weeks ago as well. So there's regular conversation. Our foreign ministers are in regular contact as well on a range of issues. And this of course comes up. Now, some of the initiatives that I touched on in terms of holding current or future collaborative opportunity for the benefit of navigating through this crisis. Those are largely in our trade commerce domain, and we have a number of things that are ongoing. We have a dialogue between our commerce, our trade department, and the Commerce Ministry at the officials level. That will eventually make it up to the ministerial level. It happens once a year, so we're looking at when that would happen, but this would feature quite prominently. Both Canada and India remain keen on further trade liberalization through an agreement, and those discussions continue as well. But perhaps the closest is on the ground here through our trade commissioners as well. A crisis like this makes us engage closer to see how we could benefit from what Canada may need, or how India could benefit from what Canada has to offer. And so those collaborative discussions through our trade commissioners, largely with the Commerce Ministry, are ongoing. Some of the thinking here as well, beyond the work of the Ministry of Health and Family Welfare, also spans or is led by Niti Aayog, the think tank for the government, that's doing some very groundbreaking, leading edge thinking around the future and navigating through the crisis and recovering as well. And so we have regular interactions with them as well in terms of areas where we could collaborate. So yeah, there's a fair bit going on. It's largely dialogue in support of existing initiatives. But as I said at the outset, a lot of what we're doing right now is thinking about what's next. You know, what we have been doing for the last few years and the strategic plan that we may have had taking us into the next few years needs to be reworked, needs to be rethought. And that's really what we are doing. And so some of the thinking that comes out of these opportunities, of course, feeds into that as well.
Excellent, great, thank you. As a closing question for Joseph, I'm inspired by Wasim Ghori, who said, Joseph, do you see new models in the healthcare sector, new models of branding or revenue generation of marketing that are coming out in response to this era, the post-COVID era?
I actually see less of that than the concept, less marketing and branding in the Canadian healthcare system than new initiatives and the embracing of new technologies, disruptive as may be, and new ideas. You know, crises usually represent game-changing paradigms. That's throughout history. You know, these black swan events, you know, usually are responsible for new design, new thinking, new ideas, and more importantly is acceptance by, I would, in our system particularly, I would describe traditional policy or game changers. We have a very traditional system as well. So I will say I see those things, and they're happening now as we speak. I also see that there are certain areas in our healthcare system that this has served as a tremendous impetus for, namely integration. You know, Canada, particularly Ontario, was a bit of an outlier from other provinces, by the way. You know, we have 165 or so hospitals, so it's very fragmented. This particular event will trigger, without question, further consolidation and cooperation and coordination. I see that. And also in between intra sectorial areas, such as long-term care, hospitals, social agencies. This is necessary, and I'm so glad that this is coming. In fact, what we try to do at Sinai, our vision was to create these kinds of systems, which, by the way, are very typical in the States, the accountable care organizations, which I actually admire. So I see those changes coming, and in a way, and it's an unfortunate impetus, this pandemic will unquestionably trigger these changes. And there are other examples, but I'll leave it at that.
Thank you, Joseph. We really appreciate it. Preetha, can I ask you, as your closing comments question, do you see whether it is specific ideas that India can bring from Canada in the healthcare sector, or do you see specific avenues where the Indian healthcare sector will change in response to the pandemic?
So I think there are some areas which we will see happening, and I'd love to be able to say that, you know, India and Canada should work together on it. One is you have a large ethnic population of Indian origin. So maybe some kind of research, genetic makeup studies, all that would be valuable tomorrow for, you know, drug development and so on and so forth. The second again is that, you know, while we don't have as big an issue on the aging population, I think the issue is there and it will become a huge issue 10 years from now. Can we jointly set systems, train people, figure out how can we really take care of the aging population? In terms of innovation, we all have to understand that the point of care is changing. It's changing from the hospital environment to people's homes, to their offices, to their, you know, to their smartphones. So can we jointly develop, redesign the point of care and take it away, make it more, you know, accessible, more viable financially, so that, you know, people will access healthcare. They won't have to pay the amount they're doing. And insurance companies, healthcare providers won't end up footing large bills because people, you know, we would have caught the disease early because we've used smart, intelligent ways to do it. So I think these are all innovations, way of looking at, you know, things, plans for the future, and I'm sure it will happen.
One more point about that, because I want to underscore what Preetha said, because it's so important. I think as you look at the future of healthcare in Canada and undoubtedly in other areas of the world, you're going to see this whole area of telemedicine and mobile health taking a major, major role. And that includes hospital in the home, includes virtual care, includes all those things, and mobile health. That's going to have a much bigger presence than it has in the past. In fact, when you talk to physicians right now in Canada and Ontario, most will tell you I'm working from home, especially in the non-dependent areas of healthcare. Surgery is dependent, but other specialties do not require hospital immediate office care. You're going to see a lot more of that. It's going to be much more prevalent. And what's happening also is they are succeeding in creating paradigms that are both effective and, believe it or not, even humanistic in the relationships with patients in this way. You're going to see more of that. I don't think it will replace current traditional practices, but I think you're going to see a greater presence of that.
Thank you both guys. If you don't mind, I would like to wrap things up with on a more personal note. Given that we have the presence of Canada's longest serving High Commissioner in India, Nadir, you're coming up to 6 years in your role as Canada's High Commissioner. I thought it's a great opportunity here to put you on the spot and give you the last word and ask you to share some of your personal reflections on your time in India. Looking back, where the two-country relationships were when you arrived and when you're living them now, as you know, maybe when things get normalized, you will move on to your next assignment. And how do you see this as the springboard to take us forward?
Well, thank you. That's a lot I could offer there. Let me say this. First of all, the first reflection would be the relationship, and I touched on this at the outset, continues to thrive. And I'm very confident that this crisis, as much as it is and will have a significant economic impact in Canada and in India, it will be weathered. We will get through this. You know, it'll take time, but we'll get through this. And I'm very confident that the momentum in that commercial bilateral relationship will continue to thrive and grow. When I took this job almost 6 years ago, I think two-way trade was around $6.5 billion. Now two-way trade has exceeded 11 billion plus another 3 billion in services. Two-way investment at that time was about 4.5 billion. It's now over $60 billion. The number of students in Canada from India at that time was about 40,000. It's now over 223,000. So in terms of, you know, some of those reflections, I think to see how quickly and substantially the relationship has grown in terms of people-to-people commercial relations has been extremely noteworthy, and there's no reason to indicate that that momentum is going to slow down anytime soon. Now, of course, we navigate the challenges of this crisis. There may be some plateauing in a few areas, but that growth will no doubt continue. The second thing I would say is, you know, if I could offer up 3 or 4 areas that I believe very, very much have potential to resonate in terms of marquee areas of this relationship. Healthcare is one of those. Digital industries and the entire technology ecosystem is another one of those, and some of that touches on healthcare, which we just talked about. And there are a couple of others like agriculture, agri-tech as well, among others as well. And I think technology will play a very significant role in that growing forward without a doubt. And then finally, I think Preetha touched on the size of the Indian diaspora in Canada. The people-to-people ties is probably the most rewarding part of this job. And when people ask me, you know, what have you enjoyed the most about India, or what really stands out, it's always a very easy question for me to answer, and that is the people. There's so much talent here, there's so much warmth here, and Canada and India have so much more in common in the context of our people, and that warmth and that hospitality that we probably don't really appreciate the full scale of that. So because of those people ties and the common attributes that Canadians and Indians alike have, I really believe that so much more will continue to happen going forward. And all of our efforts over the last few years were really designed to simply build a foundation that could carry on its own momentum going forward. And I really believe that has happened. And as difficult as the pandemic will be, and coming out of this from an economic recovery perspective is going to be, I remain very confident and optimistic about the future of this relationship going forward.
Thank you. That was great. That was, I think, an excellent way to wrap things up. I would like to thank all the people that attended this panel, that stayed with us and offered lots of questions. I wish we had more time. We had many more questions, and I see also many comments. So as before, we will take all those and put them together and get them back to you with some additional commentary. But most importantly, I would like to thank Preetha, Reddy, Joseph Mapa, and High Commissioner Nadir Patel for sharing with us their insights, their knowledge, their expertise, their perspectives, and creating a very, very engaging webinar this evening. Thank you all. Goodbye. Have a good weekend.